When Louisa Lee Schuyler founded SCAA in 1872, her goal was to improve the well-being of people living in state institutions due to poverty. She witnessed firsthand the inhumane conditions in state institutions. No heat, no running water, poor food. She believed that one of the reasons these conditions persisted was that regular people were not aware of them. And if more people understood the problems, it would motivate improvement. She brought others in and insisted that they understand, and based on those experiences, raised her voice for change. She achieved her goal through partnership and organizing and advocating for state laws that centered those in need. In doing so, she set the course for the next 150 years of SCAA advocacy rooted in compassion, evidence, and a belief in a government that works for the greater good. Today, SCAA lives out Louisa's vision of advocating for lasting change on behalf of those living in poverty. The pandemic brought heightened awareness to the problem of childhood poverty and systemic racial inequity. This isn't a solitary fight, and it never has been. The Schuyler Center's mission relies on collective action. Like Louisa, who gathered like-minded friends and people in every community across New York State to push for better care of New Yorkers living in poverty, the Schuyler Center remains rooted in partnership. Together with coalitions of advocates and service providers, state agencies, legislators, donors, and our own like-minded friends, we continue to fight for a New York in which everybody has the opportunity to thrive. We're really, really excited to welcome you all today and excited to share this data with you. We're disappointed that we're not in person. We're usually in the legislative office building with all of you, but we're excited because for many of you who might not otherwise have been able to travel, you're able to join us today from the far reaches of the state. So we're very excited. The data book will be available on our website today, as will a data sources document. This presentation is being recorded and we'll have a link on our website in the next 24 hours. We'll be sure to leave time for questions. For members of the press, at 10:45, we'll get back on Zoom and happily answer your questions. Any member of the media who would like to join us can send a message in the chat. And now I'd like to pass the mic to our Director of Policy, Dede Hill.
Good morning. And I just want to echo what Kate said. I so miss being with all of you in the legislative office building. I really miss like the pre-presentation chatter and post-presentation chatter and the coffee. But next year, right? Next year. So before we dive into the data, I am going to ground us in what we all know, and that is what all New York children need to thrive. They need strong and economically stable families, healthy bodies and minds, safe homes and communities, and a sound education. Children need all of these things to thrive. Yet too often in the context of budgeting decisions, the question is asked, usually it's just suggested, but sometimes it's asked explicitly, what do children need more? What is most urgent? Because we can't do it all. The answer, of course, is that all children need all of these things, period. Unfortunately, these past 2 COVID years have caused tremendous disruptions in all aspects of children's lives, and the toll has been heavy. More than or nearly 7,200 New York children have lost a parent or primary caregiver to COVID-19. And that data is from June of 2021. So those numbers are unfortunately likely higher. And of course, many more have lost grandparents, aunts, uncles, beloved teachers, family, friends. And food insecurity remains high, even as we've begun to emerge from what we hope is the worst of the pandemic. An early December Census Pulse survey tells us that 13% of New York adults have reported that there was sometimes or often not enough food in their households. And national data tell us that there are significant racial inequities in food security, and especially insecurity is especially high among Black and Hispanic families. And 2 years into the pandemic, our young people are facing a severe mental health crisis. So in short, New York children and families are hurting, and also struggling is the workforce that serves our families: childcare educators, the human services workforce, the home health workforce, our early intervention therapists. This is a workforce that is overwhelmingly women. It's predominantly women and New Yorkers of color. All are underpaid and undervalued, and that has been the case long before the pandemic, but they have really been pushed to the brink with the added challenges the pandemic has brought. So the challenges are formidable. However, there really is a silver lining. Federal and state government quickly rolled out interventions that were tremendously successful at buffering families and children from the harshest impacts of the pandemic. Many of the supports are ones that experts and advocates like the Schuyler Center have long urged government to adopt. And the good news is that many of them worked. In fact, pandemic relief programs were so successful that the supplemental poverty measure, and that is the poverty measure, unlike the traditional federal poverty measure that we're all familiar with, the supplemental poverty measure adds the value of in-kind benefits like food and housing assistance, refundable tax credits, pandemic stimulus payments. So it adds those in, and accounting for those, the supplemental poverty measure actually declined nationally in the middle of a pandemic. Among the effective interventions were the 2 stimulus payments that reached many families across the nation, particularly the second one, which reached many immigrant families excluded from the first. Also, SNAP benefits, or some people refer to them as food stamps, they increased by 15%, staving off some of the worst food insecurity. Another lifesaver for New Yorkers and families, robust Medicaid coverage was there for New Yorkers who lost their jobs, who experienced reduced income. Enrollment increased during the pandemic, and no consumers have been disenrolled during the public health emergency. So that means Medicaid worked. It worked exactly as it is supposed to work. It helped to keep families healthy. It protected families from the financial ruin that medical bills can cause the uninsured. And of course, one of the biggest game changers, and this is what the data won't show up, we'll be talking about it next year in more detail, but the expanded federal child tax credit, it is projected that it will cut child poverty in the nation by 45%, with the strongest impacts among Black and Latino children. So there are things to celebrate. So now I'm gonna dive into the data. So child poverty, now the data that is on the screen is pre-pandemic data, 2019. And what this data really tells us is that too many New York families entered the pandemic without any economic reserves. Disproportionately Black and brown families due to historic, structural, and ongoing racism. So pre-pandemic, 18% of New York children lived in poverty. 37% lived in families that really lived paycheck to paycheck. So what that meant, these families were in no position to stock up on food and toilet paper and diapers and medical supplies during those early intense months of the pandemic, when the store shelves were empty, when all of us were holed up in our homes to stay safe. Another really important indicator of family economic security is women's unemployment levels. So, of course, one of the headlines of the pandemic is that women have disproportionately dropped back or out of the workforce in great numbers. And while you can see from this chart that the women's unemployment numbers have improved significantly since this time last year, the numbers are still disproportionately high, and particularly if you factor in the number of women who have withdrawn from the workforce altogether, those are women who are not looking for work. And these high rates of unemployment, they are of great concern for families, not just right now when families are doing without an important breadwinner, but also looking ahead. There is clear and ample data that shows that gaps in employment make it hard to break back into the workforce, and they can also have significant effects on lifetime earnings. So families are going to be struggling with the impacts of women's unemployment for many, many years to come. And of course, one of the many reasons women have left the workforce in such high numbers are the childcare disruptions the pandemic has caused. And another barrier to women's workforce participation, both during the pandemic and also, of course, long before, is the high cost of childcare. And yet, due to inadequate investment in childcare subsidies, nearly all families, including low-income working families, must cover these costs on their own. And as this slide shows, the income eligibility cutoff for childcare subsidies, which are the principal means of childcare support for families, are so low that even families where we have two wage earners earning just the minimum wage, those families cannot and do not qualify for subsidies. And so what that means is these families are left to cover the cost of childcare entirely on their own. And that means that most of them are facing childcare costs that are up to a quarter of their income, which is an unsustainable economic burden. It's really also important to point out that there are also many other hurdles to accessing subsidies. Parents and caregivers facing unemployment often cannot access subsidy, and so they have to search for a job while caring for children. Parents struggling with disability do not always qualify for subsidy. Foster parents don't always qualify. And even if a family is approved for subsidy, it can take weeks, even months, to actually get those subsidies, which can mean that job opportunities can't wait. Notably, Governor Hochul, who is a longtime champion of childcare, she acknowledged the childcare crisis in last week's State of the State. Unfortunately, the two childcare proposals included in her address, one was an extremely modest expansion of access to childcare subsidies, the other, a small workforce stabilization grant program. These proposals do not meet the challenges and the opportunities of this moment. We are hopeful the governor's executive budget contains the transformative proposals and investments New York children and the childcare sector need. All right, let's talk about some solutions. So here are actions we urge New York to take this year to improve economic security and expand access to childcare and early education. So first, take decisive steps this year to reduce child poverty. Recently, New York enacted historic legislation, the Child Poverty Reduction Act, which commits New York to cutting child poverty in half in a decade with a focus on racial equity. Reducing child poverty is hands down one of the best ways to improve child well-being overall. So we are excited and eager for the Child Poverty Reduction Advisory Council to be convened in the coming weeks and to get to work. At the same time, New York should expand its refundable tax credit, starting with its child tax credit, the Empire State Child Credit. New Yorkers and families across the country received their last federal enhanced child tax credit payment in December. So it is time for New York. It needs to step in and meet the ongoing needs of families in New York and expand our own child tax credit. We need to cover the currently excluded children under the age of 4 who are inexplicably not included in the state's child tax credit. Also excluded are families in deep poverty. We must expand our child tax credit to reach them, and our 17-year-olds. They are also excluded. So New York needs to reach all of our children and increase the amount of the credit to bring families meaningful support. Third, New York must fulfill the promise of universal pre-K for families outside of New York City. Our families outside of the city have waited for too long. And finally, this is the year that New York must take large steps toward phasing in universal childcare. To be clear, what is needed are not Band-Aids applied to the current broken childcare system, but swift transformation to universal childcare. And with that, I am going to turn the virtual podium over to my colleague, Crystal Charles.
Thanks, Dede. New York's children and youth thrive when all families, caregivers, and communities are well supported. This is especially true during a pandemic. 2021 highlighted the importance of preventing and mitigating health, mental health, and financial issues for children and families before they become crises. Many of the federal provisions that Dede covered earlier helped stabilize families over the past year, did exactly that. But we're not out of the woods yet. We do have 2020 data in the area of child welfare, and some of it is encouraging. Child welfare preventive services, including home visiting, housing assistance, childcare, and cash grants, are designed to help families stay together and provide an environment where children can thrive. In 2020, over 40,000 families and more than 80,000 kids were served by New York's preventive services. Children and families need support before they enter a crisis. Yet 60% of children entered foster care in 2020 without first receiving preventive services. This is especially true for infants, who are more likely to be placed in foster care while being significantly less likely to receive preventive services before placement compared to older children. In 2019, Black children were over 5 times more likely to be in foster care compared to white children. In 2020, that went down to 3 times more likely. This is still too high, but at least it may be moving in the right direction, especially considering that the overall number of children who entered foster care in 2020 also decreased compared to 2019. Foster care placements are also moving in the right direction. In 2020, New York finally surpassed the national average in the percentage of approved relative home placements, which can include foster parents who are kinship caregivers, meaning caregivers who the child already has an existing relationship. They could be family or a family friend. Congregate care placements, while lower than 2019, were still higher than the national average. The pandemic hit transition age and former foster youth hard. Respondents in a 2021 survey reported experiencing challenges that caused them to fall behind or abandon their education, unmet medical and behavioral health needs, unstable and substandard living situations, food insecurity, underemployment and low-wage jobs, and emotional and physical repercussions of enduring chronic stress. Many of us will find any number of these issues familiar, but the major difference is on top of these issues, transition age and former foster youth tend to lack the family supports many of us take for granted. Absent from the governor's state of the state was any mention of the children and families involved in New York's child welfare system. These New Yorkers are facing the most daunting challenges. Their needs should be centered for New York to recover from this pandemic without leaving anyone behind. To improve child welfare, New York must reduce child poverty, strengthen preventive services by making sure they are fully funded, support family-based and kinship care, including reducing congregate care, and support transition age youth. With that, I'll pass it to Lara.
Good morning. I am the coordinator of Medicaid Matters New York, which is the statewide coalition representing the interests of people who are covered by New York's Medicaid program. Medicaid is public health insurance coverage. It's funded by the federal government and the state government and localities, and it provides comprehensive benefits that are affordable for people with low income. The Medicaid Matters Coalition is housed here at the Schuyler Center, which is a very good fit for a number of reasons, but particularly because the policy goals, our policy goals are very much aligned as it relates to New York children and families with low income. As you see on the slide, there are now over 7 million people enrolled in Medicaid in New York. The data that we have is not refreshed. We have some data from August of 2020, but there is a tremendous amount of data that is tied to the census that is not yet available. There is detail-oriented insurance coverage data that we rely on, that we use in our advocacy and policy goal setting, that will help us going into our next, the goals and policy goals that we have going forward when we get that new data. So this slide is from a very recent report by the New York State Office of the State Comptroller. And the pandemic Medicaid enrollment really tells the story of the importance of the Medicaid program. The light gray bars that you see in the chart, the broader bar to the left represents the economic downturn during the 2008 recession. And the skinnier bar to the right represents the economic downturn that began in March of 2020. And what you see Starting during that recession in March of 2020 and going into the following year is a dramatic increase in Medicaid enrollment. And as Dede stated before, Medicaid is one of the programs that did what it was supposed to do. It served as a social safety net. It was there for people during the economic downturn, and it prevented people from being uninsured during a tremendously important time for them to have critically needed health insurance. One of the things that we know is tremendously important in as it relates to Medicaid coverage is making sure that we remove barriers to coverage. We are thrilled that Governor Hochul is proposing to eliminate the $9 monthly premium in the Child Health Plus program for some families with low income. It was included in the governor's State of the State policy book. What's particularly poignant about this is that when we were looking into this particular issue, we learned that in pre-pandemic data in 2019, almost 70,000 children lost their Child Health Plus coverage due to failure to pay the monthly premium. That is astonishing in a program that covers about 400,000 children. For 70,000 children to lose their coverage due to failure to pay that premium. $9 may not seem like a tremendous barrier to some people, but a $9 monthly payment proved to be a barrier for those families. And unfortunately, those children lost coverage. So we know that, as Dede stated before, Medicaid is tremendously important. It is one of the examples of one of the programs that did exactly what it was supposed to do during the pandemic. And those pandemic numbers that I pointed to, with a nearly 1 million increase in Medicaid enrollment because of the pandemic, really show the true importance of the Medicaid program. And there really can be no doubt that Medicaid is an important part of the puzzle. We need strong Medicaid policy as part of the solution to reaching greater health and well-being for children and families. The first piece of the puzzle here is, of course, reducing child poverty. And we know, as Dede stated earlier, Medicaid helped keep people from financial ruin. Medicaid can contribute to reducing child poverty by promoting family economic security and keeping people from financial ruin. We know that Medicaid can promote overall health and well-being by providing the comprehensive services, medical, mental health services, oral health services. A variety of services are covered in the Medicaid program, and we know that Medicaid coverage allows people to stay well overall. We also know that a strong Medicaid program will help us reach greater health equity. It allows people to, as I just stated, to stay well physically and mentally. It allows them to access services in ways that uninsured people cannot. And so we know that it is an important piece of the puzzle as it relates to reaching greater health equity across the state. And then lastly, we must remember the intent of the program. We will continue to turn to that pandemic data to demonstrate that Medicaid did what it was supposed to do. It was there as a lifeline for families during the economic downturn to make sure that they had health insurance coverage at a very critical time in their lives. And that is exactly the intent of the program, to serve as public health insurance coverage for those who need it. So I will turn now the microphone over to Bridget Walsh.
Thank you, Lara, for providing some context to the health section of the data book. I'm going to start with this definition of health, just to provide a backdrop for how we approach putting this section together. The World Health Organization defines health as a complete state of physical, mental, and social emotional well-being, and not just the absence of disease or infirmity. Through that lens, the policies and programs that go beyond simply providing medical care, those that you've heard about already today that include alleviating food insecurity or providing childcare, all relate to and support health. This definition also encompasses factors that predict a child's future health, such as social, emotional, and mental health. Even before the pandemic, many of New York's children, particularly those living in poverty, struggled to access health and mental health care. Now the needs are greater, but there are additional barriers to receiving services, including reduced access to places where children find care, such as schools and community-based programs. Since the beginning of the pandemic, when physicians' offices, clinics, and schools closed, children have missed primary and preventive visits. National data show that children living in households near or below poverty are 20% less likely than children at higher income levels to be current with vaccinations. And across the country, fewer children have received dental exams in the past 12 months than before the pandemic began. The path to adulthood was already difficult, but as the Surgeon General recently noted, today's challenges are unprecedented. During a time of life when children and youth are reaching developmental and emotional milestones and learning healthy social skills, today they are also forced to navigate a pandemic. Almost 1/4 of New York's children have a mental, emotional, developmental, or behavioral problem. Many of these children have difficulty finding care. A few years ago, about 1/3 of families found it somewhat or very difficult to access mental health care for a child. That number was far too high, and yet now almost half of families report that obtaining mental health care for a child is somewhat or very difficult. This is among the reasons that the pandemic's toll on children's mental health is recognized as a crisis. The outlook is similar for children needing developmental services. This is a concern because early access to services that help a child reach developmental milestones can have a significant impact on that child's ability to learn new skills, overcome challenges, and be successful in school and life. And mental health services are not only necessary for children, parents also require access to early and consistent mental health services. The inability of a mom to receive maternal mental health care can have a devastating consequence for her baby, and her family. National data indicate that maternal anxiety and depression are the most common complications of childbirth, impacting up to 1 in 5 women. Yet not all pregnant and postpartum women are asked about their mental health. These last 2 slides make it clear why systems must connect the care of children with the care of their parents. The foundation of a healthy, successful family rests on coordination across maternal and child health. So what are some of the solutions? First, reducing child poverty is also integral to improving health. Children who experience poverty, particularly during early life or for an extended period, are at risk of a host of adverse health and developmental outcomes that can continue throughout their lives. Also, New York must make a 2-generation approach to maternal and child health a priority. Health systems, including financing, must provide care for the whole child, including physical, developmental, and mental health needs, as well as a recognition of the importance of the parent-child relationship. A family-based approach supports parents, addresses their health and mental health needs, and assists in providing the social and economic services necessary to create stable households. To move New York closer to this 2-generation approach to health, it is imperative that families receive robust health coverage and access to services. To relieve stressed families from having to re-enroll in coverage during the critical first years, we are advocating that the state provide women 3 years of continuous health coverage after the birth of a child. Additionally, every child should be provided health coverage until they reach age 3. When these policies are in place, systems can develop better care coordination models and create pathways to early identification of mental health concerns or developmental delays. The governor's state of the state proposal to extend postpartum coverage for 12 months is a good start. And the two-generation approach must also include significant investments in both mental health and early childhood developmental services. Retaining the current workforce and expanding the number and types of providers in these sectors must be the foundation of a strategy to secure the health of young children, teens, and parents. Finally, we need to think about public health as integral to addressing the needs of children and families. This means ensuring that New York's public health infrastructure has the capacity to prevent disease, promote health, and prepare for and respond to both emerging threats and the social determinants of health. And with that, I'll turn it back over to Kate.
All righty. Thank you, team. So we know that that was a lot, and our data book is filled with a lot, and of course, so much more is on the table. So we're excited to take your questions, talk a little bit about some of the specific questions that you have related to the data and how they fit into policy making and how they fit into the state budget. That, you know, what we heard sort of I guess I would say a little bit of a whisper last week from the executive about what we might hear, what we might see in the upcoming budget. So we'd like to talk about, respond to questions about the data and make the connections between this data and the forthcoming budget conversations. So with that, if the policy team would like to turn your cameras on, that would be helpful, because I'm monitoring the questions, and I think I'll know who to direct them at, but please, you know, feel free to interject, all of you. So Crystal, one of the questions is about, you mentioned preventive services, and, you know, in all of our work, we talk about prevention. You know, when you're talking about good policy, prevention should always be top of mind. So we talk about it in health, we talk about it in child welfare. And so when, Crystal, you're talking about it, you're usually talking about what we all refer to as child welfare preventive services. So can you talk about what are child welfare preventive services, why they matter, and the importance of this year?
Definitely. So I'll kind of start at what child welfare preventive services prevent. So in the worst case scenario, a child is separated from their family because of concerns about safety or neglect, abuse, etc. But for the majority of families, they simply need assistance in some way for their child to stay safely at home with them, and for them to be able to provide an environment where their children can thrive. So I gave a few examples of these kinds of services earlier, so they include home visiting, housing assistance via subsidies, for example, and some of the issues that flag families for the child welfare system are often poverty related, such as maybe not having enough to pay the heat bill in the winter, something like that. So preventive services are meant to assist families in providing those basic needs for their children. And the importance of that this year especially is the funding for these preventive services is coming up for reauthorization this year. And currently the state provides a 62% share of that funding to counties. In statute, for this funding, the state should be providing 65%. So this year, we're hoping that not only are the funding for these services reauthorized, but they're also reauthorized at the full state share, which is 65%.
Thank you, Crystal. And I think, you know, as we show, one of the reasons we called this out in our data report is that preventive services are really only available on the child welfare side, you know, when it kind of far down the road, when a child is really at very close to removal. And the data we have show that most kids who end up in care don't even have access preventive services. So it's not as though everybody gets them. So that's an important, I think that's a really important data point. So thank you for that. I think, you know, somebody asked about the Build Back Better Act, which was the federal relief package, the next federal relief package that we were, some of us expecting, some of us hoping to see before the end of 2021 to help with some of the, help with a variety of issues, including infrastructure and some of the financial concerns that people have. And including, part of the Build Back Better was a continuation of the federal child tax credit that has really helped families. And Dede, can you talk about sort of in the absence at the moment of Build Back Better, what we should be thinking about right here in New York State?
Yeah, and so, I mean, I will start by just speaking frankly about how, terrifically disappointing it is that the federal government has not been able to deliver on Build Back Better, because we know that when all of government, federal and state, are focused on our children and our families, and on our communities that are too often left out, we all do better. So this really should be an all government effort to really to build back better, to come back from the challenges of these last several years stronger and with a more equitable, racially equitable, child-focused world or state or country, at least, right? So it's disappointing, but I think that the path forward for New York is really, really clear. New York needs to lead. And, New York has never waited before to deliver for its residents. New York was among the very first states to raise the minimum wage. Federal government is still at $7.25 an hour. New York has among the strongest paid family leave programs in the country. We have a strong and expanding universal pre-K system. This state has a long history of being responsive to and meeting the needs of our children and families, no matter what the obstacles are. So we know that what New York children need right now is they need universal childcare. They need a robust and inclusive child tax credit. They need to be centered in our recovery. So it falls upon New York leaders to do the hard work. Of leading. And, I think another really important point over the weekend, the Times Union, many other the data is clear. New York is in a strong financial position. Our state revenues are greater than expected. New York received $18 billion in federal pandemic relief and has only spent a quarter of it. So we have the funds, and now it's time for New York to lead and to lead boldly.
Thanks, Dede. I definitely want to pass it around, but I do see another kind of a question that's related to federal issues and state implementation that I don't want to miss, because I see it, a question that came in related to, there's the, on the child welfare side, New York is implementing the federal Family First Act. So can you talk about, Crystal, sort of implementation of the federal Family First Preventive Services Act, and how, the question here is how that may impact funding for primary and preventive services in New York?
Yeah, definitely. So Family First prioritizes family-based placements, especially kinship placements over placements in congregate care, and also prioritizes the use of preventive services. So this act is tied to federal funding for states. So as long as states follow these priorities, there's more funding for these preventive services. Most of it seems to be for what we'd call secondary preventive services, where the family is already kind of involved with the child welfare system in most cases, but it does help support these services, and also support programs that are evidence-based, in other words, proven to work and be effective in helping families. So just overall, that's how we see Family First impacting the funding for preventive services. So it plays a major role in being able to effectively serve families who are already involved with the child welfare system.
Thanks, Crystal. So one of the things, Bridget, that you mentioned only briefly was related to public health and our public health infrastructure. And I mean, nothing like a pandemic to shine the light on a broken infrastructure. So can you talk a bit about, sort of from a public health perspective, what some of the important issues and priorities are?
Yeah, it's a great question and an interesting one during our 150th anniversary, because if you look at our history, we're grounded in public health and really the beginnings of public health, not only in New York, but in the United States. And I know we have a lot of history coming up this year on our anniversary, but so you're going to see a lot on public health. So it's a great question for us this year. One of the things that the state has not done well over the last number of years is investing in the local public health infrastructure at the county level. There was a recent report by the Association of County Health Officials talking about the number of staff that are being lost at the local level. And especially at this time when we're in the midst of a pandemic, that's very worrying, and we need to shore up that public health infrastructure. But even in the sense of trying to create something like a robust 2-generation approach to health, so many of the maternal and child health services are at the core of what public health does at the local level. So I think we need to be looking at not only addressing pandemic needs for the state and local county health departments, but figuring out how we shore up those core public health functions so that going forward, we can really start to include and integrate local public health into many of these changes to the health system that we're trying to undertake.
Lara, hopefully this is relatively quick. There's a question about the governor in her state of the state mentioning something about expanding Child Health Plus, which is just as you mentioned, Medicaid is a relatively large program. It serves, people of all ages who are low income and or disabled. And CHIP is a smaller program, serves only children. But what can you, there's some question about what was in the state of the state related to CHIP other than the $9, removing the premium, the $9 premium.
Sure. The other thing related to the Child Health Plus program, which I have to take the opportunity to mention, the Child Health Plus program is by far one of the greatest success stories New York can claim. It serves, it covers children up to 400% of the federal poverty level. It's a comprehensive program. I will say that what the question is alluding to in the policy book. So there is the State of the State speech. It wasn't mentioned in the speech, but in the State of the State book, there is mention of the removal of the $9 premium, which we talked about. There is also mention of aligning some of the Medicaid benefits with Child Health Plus. So taking some of the Medicaid benefits, in particular, mental health services for children and adolescents, and including them in the Child Health Plus program, which is significant. That would mean that even though it's a small program, the children and adolescents in that program will now have access to some of the benefits that are provided under Medicaid. And as I said, in particular, they are mental health services.
Thanks. And we do know the data are really clear that our young people are facing significant and severe and escalating mental health crises. We have some of that data in our book as well. Thanks. So as we here at Schuyler celebrate our 150th anniversary, we are so excited and honored to continue Louisa Lee Schuyler's work of tying compassion to active change and achieving results. Our unique focus on disenfranchised children and families includes research and analysis, evidence-based approaches, and a firm belief in inclusion, not preferential treatment. The results of this approach can be seen in New York's child welfare programs, policies to address child poverty, and legislation that centers the needs of those traditionally pushed to the margins. We've inherited Louisa's compassion and her determination, and together with all of you and our partners across the state, we're fighting for a future that realizes her vision of a government that works to ensure that everyone has the opportunity to thrive. We look forward to working with you all in 2022 and beyond. Thanks for joining us today.